I've not spoken to you already, good morning. I'm so happy to see all of you here. It is what I consider a critical time in our country as well as right here at home with what is happening with a lot of the programs and opportunities that have previously been available in our community. Again, I'm Mamie Nicholson, president of the Self Family Foundation. Here in Greenwood, the Self Family Foundation was established in 1942 by James C. Self, specifically to build our hospital. And our hospital is now a regional healthcare system, one of the finest in the Southeast. So we're really proud of how the hospital has grown and has been able to take care of our community for all of these years. To date, the foundation has invested over $70 million, close to $80 million, primarily in Greenwood County to support our nonprofits. And I have been out here fighting for our nonprofits for over 30 years in this arena. I know you are familiar with a lot of the nonprofits. I know some of them have come before this group before, but right now we need to consider the stress that is being put on their budgets and on their staff to keep the doors open. I polled some of the nonprofits that we fund here in the community to ask them about the impact. First of all, we went back to when the executive orders came out. They started coming out, I think, in May, and when they came out, they came at midnight. Of course, all the nonprofits and everybody else is asleep or closed or whatever at that time of night. So they woke up in the morning to orders saying their funding had been suspended. And having received those executive orders, of course, my phone and my email and my text and everything was going off that next morning about what can we do and how can the foundation help in the event that they were not to be able to continue to operate for the rest of the year. It turned out that it was not such a dire situation at that moment, but now that the big, beautiful bill has passed, the nonprofits are having to look at their budgets to figure out how they can maintain staff, to find additional funding to carry them, and of course, to keep their staff that they have in place. Some of you may not know, but a lot of our nonprofit employees need health insurance themselves because the nonprofits aren't able to provide that for them. They're not able to provide benefits for our nonprofits. So they're actually working in an arena where they qualify for the services that they provide. Now just think about that. If you're running the food bank and you need health insurance, or your salary is not, and I'm not saying that that's what's happening with our food bank. This is just an example. Your salary is not sufficient to pay your rent and to purchase your groceries and to do all of that. The guidelines, the income guidelines, your salary falls into those guidelines to receive public assistance. And you're providing the services for others in our community when you need that, you and your family need those services yourself. That is often the situation with our nonprofit organizations here in our community and across the country, not just in the state of South Carolina. But currently, they are being affected by not being able or allowed to apply for some federal grants that they have been able to apply for and receive in the past. Those have been paused. So not having the ability to apply for the funds, even at this point, that lets you know that they will not be receiving those funds for next year. So they will be in a situation of trying to find those funds to keep the doors open in 2026. We have already at the foundation awarded some grants to assist our nonprofits in carrying through until all of this is settled and they are able to figure out where they're going. The state did not award any nonprofit funds this year. They have typically in the past accepted some requests from organizations for support, such as our food bank, our shelter for abused women and children, our Beyond Abuse, sexual trauma and counseling. They have been able to apply and get some funds from the state. But this past legislative year, no funds were awarded to any nonprofits. They are called, what's it called, honey? Earmarks. Yeah, they're called earmarks. So that's when you hear no earmarks, those earmarks were not done this year. But that affects our nonprofits from healthcare all the way down to the arts. The Arts Commission, the Arts Centers, the free clinics, the children's programs, all of those programs are affected. And when you look, we're talking this morning about health care. When we consider health care at the Self Family Foundation, we look at it in a holistic manner. We look at the social determinants of health. That includes having available fresh foods. That includes housing. That includes living in safe communities. That includes not just physical health, mental health. All of that is included in the social determinants of health. So any of those organizations that are affected affect that family unit and affect our community unit. So we need to be looking at opportunities to assist those organizations. I'm going to tell you about just one example here, and maybe I'll tell you another. Sometimes I start talking and I just can't stop. So y'all just have to stop me. So I'm just going to give you one example right now of one of the organizations that is a key organization in our community. They provide everything from child care to elderly care, senior health, elderly health care. And that is Community Initiatives. They have a child care center that is a nonprofit child care center. And we all know how desperate we are in our community for child care. That child care center was funded initially by the Self Family Foundation, and they continue to receive funding from the foundation. They also have an after-school program to keep our children safe and off the street, Safe Haven, that's located down at the Matthews Mill Village. They also have a free clinic, Clinica Gratis, that serves some of the citizens, some of the individuals in our community that may or may not be citizens, but primarily low income and Hispanic and African American families at the Clinica Gratis. They have to absorb this year $205,000 in lost funding. Some of that comes from SNAP. Do you all know what SNAP is? Okay, SNAP is being cut. AmeriCorps, that was eliminated, really. So a lot of our nonprofits use AmeriCorps AmeriCorps students as staff, and they receive funding to support that. The Department of Education, they lost $75,000 to help support the after-school program there. They have already lost 2 staff, one at the after-school program and one at the clinic. They receive some funding for the Toddler Learning Center. They take toddlers from age 2 to 4 to get them ready to go into kindergarten. They have been affected, and those families who receive that support are on a sliding scale for their child to attend the Toddler Learning Center. Those families, in addition to that, think about it, they receive SNAP, they receive some subsidy to help them get their child in child care so that they can work. When they are cut in all of those different directions, how does that affect that nonprofit? And look at the reductions in Medicaid. They also are a benefits hub where they provide an opportunity for families to come in and apply for benefits that they may be eligible for. Families may not know how to apply. They may have missed their reapplication date. They can come into community initiatives, and the staff will sit there with them and help them regain those. As I said, I see a lot. I talk to all of the nonprofits constantly, and I hear their concerns and I hear their needs. We try to fill gaps in their need. We cannot fund them totally. We look for the gap in their funding and the gap in service in our community and try to fill those gaps and to assist those nonprofits in doing so, as well as trying to pay attention to the staff that operate these nonprofits. The staff of these nonprofits are at their wits' end. They are mentally and physically strained and exhausted. And so we need to pay attention to them as well. I'm going to stop right here. I can tell you some more about the effect that all of this is going to have on our nonprofits, but I hope that you can see that it is a snowball effect. When those funds are pulled, how does it affect the family? How does it affect the community? How does it affect economic development? Our nonprofits are a key piece of our economic development piece in this community. When our parents cannot get to work, when their utilities are discontinued, when they can't pay their rent, when they can't do all of these things, they cannot get to work. And so it is a snowball. And so we cannot look at it in isolation. We have to look at it in a holistic manner and look at how it affects everyone in our community. And that includes us. And so what can we do? We can donate. We can donate. One thing that happened in the Big Beautiful Bill is that anyone can get a deduction of $1,000 for $1,000 deduction for charitable donations. Previously, if you didn't file, you didn't itemize, you couldn't do that. So that's one thing. So you don't have to give a lot of money to do that. You can get up to $1,000 deduction for that. Another thing I think that affects health care, and then I'm going to sit down, is the loan forgiveness program. If you have medical personnel, a lot of them, when they first come out of medical school, will go to work in rural communities in the nonprofit arena. They can work there for 10 years, and they can get their loans forgiven. If that goes away, that eliminates the opportunity for most of them to come and work in the nonprofit community, because they can go to work out there in the private sector and make a whole lot more money than they can in a nonprofit arena. That has been an incentive that is now being taken away as well, being looked at as taken away. As long as they make their payments on time for 10 years, they can have the rest of the loan forgiven. But that is being looked at as discontinued as well. Thank you so much for your attention this morning.
I've got several questions coming in. Please continue to write those down. They'll feed it up to me, and then we'll get to those in a second. Let's connect the dots on one thing here. It is great that we can now all contribute $1,000, and I encourage you to do that. But with our vote, we can control billions of dollars. With our vote, all of these things that have been done politically from a federal perspective can be undone. So yes, contribute. Yes, support the United Way. Yes, support all your local organizations. But we're doing that pennies at a time when with our vote, we can sway billions of dollars. It is imperative that we wake up, stand up, and push back against this. All right?